Hi, welcome. My name is John Flett. I'm a paediatrician who helps families, children, young adults that think and learn a little differently. And ADHD is a passion of mine. I have realized how important it is to unlock and help children realize their true potential. Medication is a cornerstone of that management. And it's one thing making a decision on when to treat. Starting medication is often a lot clearer. It needs a kind of an understanding of the ADHD symptoms and where they're coming from and the impairments. Some possible reasons to include in starting medication is behavior problems at school and at home, difficulty keeping friends, problems after school and activities and sports, trouble in the classroom and falling behind at school. These are things that I'm sure that you clearly recognized when you embarked upon the journey to treat. In my practice, I see children follow children up, and sometimes over many years. But the weak link in that chain is often intermittent treatment, compliance, stopping medication, sometimes for no good reasons. When should you stop medicine? One of the first questions I get asked during an assessment from parents is, how long is my child going to be on medication? So if these are things that you're interested in, stay to the end of the video and I'll try and help you understand and give you an insight as to maybe how long your child needs to stay on medicine and when they potentially can come off their medication. So for these children with ADHD medicines, usually stimulant medicine, it's recommended that the treatment is to target those core symptoms. Behavior therapy is also important, and also it's recommended that diet, exercise, holistic management, treating the comorbidities. So it's one thing getting frustrated that the medicine's not working and I'm just going to stop, when maybe those other aspects haven't been dealt with. Anxiety, learning disabilities, difficulties with behavior, emotional control. So if not looking at just ADHD medicine on its own, it's important to consider holistic management of everything. So when should you consider stopping medication? It's usually not that clear when you should take your child off medicine. After they've been doing so well for some time, should you take a break from the medicine? Should you just stop at the end of a year? A lot of parents say, I'm going to stop, give my child a break over the holidays, and let's see how they start. That's not such a good idea, because the start of the year is often a stressful, difficult with transitions, and often it may mean that your child could have come off medication, but not quite at the beginning of the year. So this might seem reasonable to some parents, as many adults are now getting diagnosed and treated for ADHD. Or perhaps one of the factors that I'm going to mention below caused you to think about stopping the medicine. Too many ADHD medication side effects like appetite, moodiness, sleeping problems. When they don't want to take their medicine anymore, a lot of parents say, my child doesn't want to take their medicine. And clearly, you the parent, your child with ADHD who's immature in some way, and let alone a small child or a young sort of teenager, they don't know what's best for them. So it's very important that you know and you make the decision. You can't ask a teenager what's right for them. Just think about what they think is important. PlayStation, social media, eating what they like, going to sleep when they want. Come on, it's important for us as parents to make that decision. So at the beginning of each year, a lot of parents like to think, well, maybe do they need it? And often I find parents stopping medication. And now this time of the year, we're dealing with some disasters. A child struggling. It's like giving a child an option. Do you want to wear your glasses? Your spectacles. A child that needs them to read the board, understand, or somebody who has a hearing aid. It's like saying, do you really want it? Medication is fundamental to the management of ADHD. So by themselves, none of these are really good reasons for a child to stop their medication. Now, signs to consider that your child might need to come off medicine. Unfortunately, once a child is on ADHD medicine and they're doing well, it's difficult for a lot of parents to decide, I don't really want to rock the boat. And of course, for the doctor as well. They're doing so well, how do we know that they really need their medicine? So if we don't sort of kind of ask these questions, we won't ever be able to validate and understand when your child should come off medication. So as part of a periodical sort of follow-up, what I suggest to my patients is that they should look for signs. Your child is well controlled, free of ADHD symptoms for at least 1 year while taking medicine. And you haven't had to increase the dose of medication despite your child having grown, gained weight for the last year or two. And ADHD symptoms are not noticeable on days when you don't give that medication. And also, you've got to interact with the teacher. Because a lot of parents say, well, I don't see any symptoms at home. And yet the teacher will see a lot of these symptoms. That's why it's critical that you get a professional assessment where the doctor can give a comprehensive rating scale feedback from the teacher. I find that feedback absolutely invaluable. It's like having a CAT scan or MRI on the brain. It's invaluable, because what you see at home might not be what is seen at school, and other way around. A lot of teachers might say, well, your child doesn't really need to be on medication. I see absolutely very little symptom of ADHD, but at home you see the emotional, the behavior, because your child's masking at school, holding on, trying their best to kind of mask those symptoms. They're trying their best. Yet at home, those emotional symptoms, that disorganization, that messiness, that difficulty socially. So there are different reasons. So when to stop medication? If you, together with your doctor and your child, decide to stop, it might be a good idea to choose the right time. Don't wait for a stressful beginning of the year. Wait for a low stress time of the year, maybe after the first term. Perhaps after your child's completed some tests or term papers or term assessments. Even during a vacation might be a time to look at. Since your child, might, another reason really to think about, because during a vacation, a child is not under the same stress. So when they go back to school, of course, the demands start again. So it's important to look at how's your child during the weekends, during holidays, and then back at school. So sometimes the vacation's not the best time, because let's face it, everybody who's on leave, you're away from work, you're relaxed. A child's going to be a lot better, in the holiday. So, try and start, as your child is starting a new term, to consider those options. So, things like how do you start, to consider how do you stop medication. So, this goes beyond the scope of this video, but just to sort of highlight a few areas. Certain medicines you can't just stop immediately. If you stop ADHD medicine, maybe your child's on some medicine for anxiety or for sleep problems. Some medicines which are the non-stimulants, like clonidine, it's actually a blood pressure medicine, so you can't just suddenly stop it. It's got to be weaned down. And when you stop medication for ADHD, it's only a couple of months later that you're going to see the true impact. It's not like a helicopter which the rotor blades, as they stop, crashes down. ADHD medicine helps instill those executive functions. And without the medicine, it means you as parents need to try and manage things a lot harder. Stick to diet, sleep, organization, exercise. Those are things you as a parent need to take more control of. So it needs more parenting organization. So really what I would say is, in summary, is when you should consider stop medicine. So 2 possible reasons to stop includes your child is well controlled and symptom free for at least 1 year while taking medicine, and you haven't had to increase the medication, despite your child having grown during adolescence, put on weight for at least the last 2 years. Those are things that you consider and you're worried about. Put your feelings and your comments on the Facebook group and, tell us what your experiences were when you tried to stop the medication.